Hey, my medical coding family, how's everybody doing? Hi, Emmy. Hey, Key. Good to see you. Hey, Go-Kart. LJ. Joanna, good to see you. Erin, Angela, Patrice, my Texas friend. Fagan. You take your exam tomorrow? Oh my gosh. Poor Erin. I know she's nervous as a cat. Yeah, I do have some advice for you. Janet, good to see you. Shauna, good to see you. It's back to school lessons, lots of supply sales. Awesome at the Dollar Tree. They closed a lot of them around here. I think they're reopening or something, or I don't know what's going on, but I wanted to go to one today, but ours is closed right now. How's everybody on TikTok doing? Anybody taking their exam this week or anything? You can make flashcards out of just anything too. You can also use just pieces of paper and make them. Don't have to be too fancy with them. All right, let me get over here to our document for today. Where am I at? Right there. Speaking of flashcards, if we have a POS, ooh, can y'all even see what I'm writing? Here we go. That equals $53. Where are we at? Y'all can type in chat and let me know what you think. Where are we at? Hey Tasha, good to see you. Until the end of September. You're breaking in your new ICD-10 book now. Oh, you're thinking about going through CPC, through Penn Foster. They offer Practicode, so I'll be a CPC. Practicode only gets rid of 1 year, and you need 2 years to get rid of your CPCA. But I guess if it takes you a year of coding through Penn Foster, that will take care of the second year. Yeah, the education, the classes. So, yeah, you submit your Penn Foster classes that you passed, and then also finish Practicode. That does get you the official CPC. Yes. Good job, Mabel. And Erin, yes, 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 we are a community mental health center. Absolutely. What about 32? Same thing. POS of a 32. Yes, we are doing nursing facility. Perfect. All right. What if we have a modifier that equals G? Where are we? I wonder if anyone would get this right. If anybody gets this right, I will mail you a mouse pad. One of Medical Coding by Jen's mouse pads. I got one that's left over. Where is it over here that I never did give out on my travels? So if anybody can guess this, oops, this is what it looks like. It's got the MDM on it. It's got my color coding. It's got just a lot of cool stuff on it. But if anybody can get this thing right, I will mail them this mouse pad. Where are we at? There's video. There's the mouse pad. I got a brand new one in that I ordered. And if anybody can guess where we're at if we are modifier G. Spilling cat food. Modifier G. TikTok has it. Miss B, you're the first one that I saw that got it. It's I just followed you on TikTok, BEETHENM. I don't know how to say that. Whatever that is. Missy, you just won this mouse pad. I just followed you, so now you can message me on TikTok. Give me your mailing address, and I'll send you this mouse pad completely for free. Congratulations. Good job. Good job. Good job. Good job. Let me fill everybody else in on what it was. So what I'm talking about is, let me turn back on my camera. And let me move it over here so TikTok can see. So if you are in your HCPCS book and you are at the transportation services, including ambulances. They have modifiers here. D, E, G, H, I, J, N, P, R, S, and X. And I had picked G, which is hospital-based dialysis facility. And that's what she wrote on TikTok. Amazing. Good job. Dee knows her stuff. Good job. That is an area that if you haven't yet, tab in your HCPCS book when you can find it. There's usually a couple of sections of A codes. Some A codes are, in my book, highlighted under green. And then there's another set of A codes that are highlighted in a darker green. And then there's even another section. There's 3 sections of A's, and this one's in a dark purple, bluish color. So there are 3 sets of colors of A's in your HCPCS book, and it is infuriating to find the one page that has these small little list of modifiers on it. When you do find it, take one of those tab things and just put it at the top. That way you can find it during your exam. Things that I've noticed that have been on any sort of medical coding certification exam from time to time would be the H and the S. But I hope that was helpful and fun. Get this camera moved back over here. I have a quick question about HCPCS. What's going on? What's your question, Veranda? I didn't think anybody would get that. I think I will buy her a $10 E&M flashcard. Oh yeah, that's pretty helpful. My flashcards for E&M are super helpful. Awesome. Late to the party. Hey Maggie, I just started. Or Maggie. I have a question about HCPCS book. Yes, tell me what's your question. Let me get this back over here, and let me get this thing up. Thanks for all the tapping and all the shares on TikTok. Thank you for liking the live on YouTube. Let's see how many we got on. We're going to give away YouTube subscriptions. We got 32 people on right now. And 9 likes of the YouTube live so far today. Thank you much, guys. I hope that's super helpful. It's my smallest book. I just making sure I wasn't missing a page. It's from AMA. How many pages does it have? My book has 760 pages, easy, because mine is from, oh, they can't see on TikTok. My HCPCS is from aapc. Mine has 760 pages in it because they include a lot of things that a lot of the aapc or a lot of the manuals don't. Like, I don't know if yours has the table of biological drugs in it. Ours does. It also has PCS status indicators. It has NCCI edits, so you know whether a code can pass through with a modifier or not. It also has the general correct coding policies, and then after that it has 100 of CMS updated policies and procedures. Like the first page is like blood deductibles and stuff. The next is medical necessity, beneficiaries stuff, cardiac rehabilitation stuff. Just a hodgepodge of all kinds of guidelines from CMS. Just the top 100 they might want to quiz you on, they included in their own hit picks. That's why this book is over 700 pages. Any book will work. There's only 3 questions on hit picks for the exam, but if you want the general coding guidelines and some other stuff, then these are handy dandy. You can get prior year probably off of somebody cheaper than buying it direct. Be sure and don't buy it direct from their website, because they will charge you $20 per book to ship it to you. Go find it secondhand somewhere. My Discord study group does have a room where you can purchase from people that have already passed and are passing on their books. There's a lot of resellers all over the internet. Just be careful about who you buy it from. But I do like Book Run is a nice store online that I've purchased a lot of things from, and they're always honest and good. Really like them, but I just do Google searches and find the cheapest around. I got 40 on now on YouTube and 18 likes on the YouTube. Thanks so much, guys. That's awesome. Where are we at? Let me get up my sheet again. And let's get down here to our first question. We were still on musculoskeletal practice questions. Let me move this out of the way. And let me get this answer formatted correctly for you guys. Get that off the screen. I am streaming live on YouTube if you guys wanted to head over there for a better view, but YouTube is easy. It's still Medical Coding by Jen. It's just on YouTube. If I was doing this question during my exam, what do you guys think the answer is without looking at the question, by just looking at the numbers? What do you guys think the answer is? How's everybody doing on TikTok? Any questions? Why is just flooding that? It's annoying. Thanks for all the taps. What do you guys think? Just put it in chat. What do you guys think is the answer? Go-Kart says A. Oh, Miss Kelly, she passed her exam. Oh, congratulations. That is wonderful. I'm so proud of you. That's great. I'm so glad I made a difference in your life. That's wonderful. I bet that's a big stress off of you. Yay. Your name's gonna end up being in the magazine one of these days soon. Then you'll have CEUs that are due annually or every 2 years. I post free ones in my Discord study group, so even if you've passed, you can still stay in our Discord study group. And when I find monthly continuing education stuff, I'll post it in there so you guys can benefit from those free ones, so you don't have to pay for them. Yes, any advice, Kelly? Anything you wish you'd have known that was on the exam that you didn't know? I had some new stuff too. A stent with kidney stones, maybe you should make sure. an ICD-10 code question, maybe on delivering twins. HIV couple in the lab getting HIV testing and sequencing, something or another. Could be helpful. Be sure you know about intra-arterial veins. Where would you code those? Because you're arterial, but you're also veins. So looking for those type of codes in the cardiovascular is important. Everybody ends up in the ER and dying. Be sure you know how to code nursing facilities, like that POS number that we did. ER, doing like critical care minutes. Those are always important. Kelly said, I had a question about how to code when a patient is HIV positive. Somebody is taking their exam tomorrow, so that will help out a whole bunch. That's awesome. POS, place of service. Well, if I was doing this question that I have up on my thing, I would look for two codes that are super similar, that are the closest together. So we've got the same 2s, the same 8s, and then we've got 3 answers that have a 2. And then we have 3 answers that have the 9. But the 2 answers that are the closest is the 6 and the 8. And if I was going to just pick an answer and run with it without looking at the question, I would pick B and move on with my day, because the C is more extensive or more expensive of a procedure than the 6 would be. And a lot of times the only differences in these questions is between the 2 closest codes, and they want to see if they can push you to overcode these questions. They want to make sure you understand what is included inside the CPT codes, and they want to see if they can push you to code for a more expensive one. So if I was going to do anything without looking at the question, B would be my answer. But for now, what I'm going to do is I'm going to go to those 2 codes, the 96 and the 98, and before I even look at the question, I'm going to look up the differences between those 2 codes. 282 and 96 and 98. 96 is V-shaped bone removal. It is a new code, so if you have a 2023 book, that code will not be in your book. And where's my 96? That is my 96. I need my 98. My 98 is proximal. Did I do distal or did I do proximal? And a lot of times, the only difference on those questions is whether we are distal or proximal. And you can see there's a difference drawn on that picture in your CPT book. If you're in the 2024 AMA CPT book, I'm on page 195. And you can see that they have a picture drawn, and they are highlighting the differences between the distal and the proximal end of the bone, and knowing which end is fractured. That would be helpful in knowing the differences on this question. So I'm only going to look through the question to see if I'm proximal or distal. Though that would be the only words that I would look up. KB, you passed. No, I don't think you need new books if you're going to test again in October. I have a document in my shop at medicalcodingbyjen.com that will turn your 2023 book into a 2024. You can just write in the new codes and their little descriptor that I have. It took me one night to do those notes, so it's not hard. You can turn your 2023 into 2024 if you want to. And it's an instant download on my website. Be your 3. Hey, Shauna. So let's check out our question. See if we can figure out if it's distal or proximal. Grab my grabber. Delete that. A little small. I was trying to get it all into one thing. But from the bottom up, all I'm looking is to see if I can figure out if we're distal or if we are proximal. And I'm only looking from the bottom up, because I don't need to know how old they are, where they're at. Don't need to know none of that. I just need to know if they're proximal or distal. What do you guys think? Hey, Teresa, I'm so glad you found me too. You test next Friday? Awesome. I hope you heard me spouting a few stuff to look at. Be sure and look at twin deliveries, diagnosing, HIV positive patients, that kind of stuff. They're always usually on the exam. Great. You guys are saying distal. Y'all see it? We do have a distal listed right there. So again, this one is distal and the other one is proximal. I would just pick distal and move on with my day. And that is our answer. Isn't that a whole lot easier process than trying to read this whole note, figure out about the collateral ligament attachments and some sort of hypertrophic bone, just all kinds of nightmare of stuff that they have written in here. It's a whole lot easier just to go the answers first, see what the differences are, and only look through the question just for those differences. We have 2 answers with the 80 down. So what is that code? 298. And I swear, if there are 2 answers with the same answer as the very first code in your possible answers, please pay attention to that. Make sure you go through and hyper look at those available answers and only look at the differences and see if that is helpful. Let's see, 80. I've got this code plus the 81, 82, and 83 have all been on prior exams before, sometime or another. This one is doing both sides, medial and laterally. Now you have to be careful in this area because the route into the body might be medial or laterally, because that's the way the camera goes in the body. But if you didn't do a repair on that medial or lateral side, then you didn't go medial or lateral. Does that make sense? So be careful. The camera will be mentioned that it went in on one side. That doesn't mean you get to code that you repaired something on that side. That just means that the doctor went in the body that route. So when you do find the words medial and lateral, check before it and after it to see, did they shave something? Did they put a stitch in? What did they do medial and laterally? There you go. Now, if you're on TikTok, there is a better view on YouTube. You can go over there and stream. I got 14 of you guys on. So good to see you. Thanks for the 3 shares and the 4,000 taps. You guys are awesome. Thank you, Go Kart. What do you guys think? On the medial side, we did a repair. On the lateral side, we had a tear too. So we did do both, so we could get rid of the 3 and the 1. Then it's just a difference of that diagnosis code is the same. Are we an 81 or a 21 in our ICD-10 books? Where is my ICD-10 book? Oh, it's down here on the floor. We have cheer uniform drama. I had to go find somebody to redo Travis's screen printing on his uniform. His uniform logo, whatever, is peeling off, and he just got it this week, so it didn't last. So I'm getting it like, it looks like it was like an iron-on sticker that isn't going to work, so I'm getting it laminated or whatever. I don't, screen printed? Yeah, there we go. That's the right. I'm getting it screen printed on, but the company doesn't have that particular logo, so they're going to have to create it and then get my approval. Well, I have to get coach's approval, and then if they approve it, then get it put on. But it's going to be a 2-step process. But that's where we were out roaming around today. S83 281. Our differences between the 81 and the 21 is whether we're peripheral tear of the medial or if we have a other tear of the lateral. The S83211 is for our bucket, so we know we get rid of the medial word. We don't need it. All we need to know is how do we code a lateral compartment degenerative type of tear. And if our only option is an 81, you know that the 21 is peripheral, so it has to be our 81 because it's other and we're not peripheral. Yep. So you know A is our answer. A. 21 or 211 211 is our bucket, and we already have that coded as our very first procedure, which is right there. This is the bucket. And this would be you repairing one bucket and another bucket if it was D. We didn't do 2 buckets. They only called the medial one a bucket tear. The lateral one they called a compartment degenerative type of tear, which is not a bucket handle tear. So if you did D, it would be 2 buckets. A is 1 bucket and 1 other. Does that make sense? Good, McNair. Awesome. Glad you see it now. That'll make more sense to you now, right? Good. Perfect, perfect, perfect. A is our answer. All right. What do you guys think is the answer by just looking at the answers, picking out one, just looking for similarities, irregularities, knowing what AAPC sometimes does, yeah, I'd probably pick A too if I was just looking at these. Let's go look up our differences. Let me plug up my phone here. See if I can't get some. I don't think it'll last the whole 2 hours. There we go. All right. I got it plugged up. All right. Let's go look at 20552. What's going on here? 20552. Ooh, the 50, 51, 52, and 53 have all been on somebody's exam recently before. Our differences between the 2 and the 3 is that you code them by 1 or 2 muscle groups or 3 or more muscle groups. These do not have the word each beside them. So we know we can't times these. So we know we have to, or we can, get rid of these because they're coding irregularities. Unless they have the word each in them or something along those lines, per day or per unit, whatever, you can't times them. These are just for single or multiple injections, and it's divided by 3 or more or 1 or 2. That means that these do not get timed. And you can add that to your book, that the 52 and 53 do not get timed. What about the other ones? Single, okay, 50 does not get timed, and neither does 51. Single tendon, nope. None of them get timed, so don't let them trick you on the exam. So you know it's a difference between A or B. So my difference between 52 and 53 is just the number of muscles. So we're going to go in here and not worry about how many injections were done, but we're going to worry about how many muscles were involved. So I'm going to go look for words that mean muscles. If you're in the 2024 book, AMA CPT, page 125 and 126 with all the muscle pages, all the muscles listed, is a very good page to have tabbed at the top so that you can remember to go back there, peruse those muscle names so that you remember that you're looking for extenders, majors, dorsal, longus, magnus, tricep, major, minor, those kinds of words, because they may not say we did 3 muscle groups. It may just have muscles listed. So what do you guys think? Nope, these are CPT books. This is AMA CPT. We did these muscles, we did that muscle, do y'all see any other names? There's the other one right there. So we did 1, 2, 3. 3 muscles means we're going to code B, because it's not just 1 to 2, it's 3 muscle groups. Yep, good job, good job. Rapid fire anatomy questions. What is considered a partial thickness wound? Is it damage that is not penetrated below the dermis and may be limited to the epidermal layers only, or damage that is not penetrated below the dermis and may be unlimited to the epidermis layers only? Tissues. Damage involving total loss of epidermis and dermis and extending to the subcutaneous tissue. It also possibly utilizes the bone or muscle, and a lack of blood supply may make it necrotic and non-viable. Or is it D, soft, moist, devitalized tissue that may be white, yellow, tan, or green in color? What do you guys think? I don't know what happened to my formatting here. Whew. Here we go. A is correct. Good job. Everybody got that one. I know y'all are sick of this one, but this one comes up on the exam a whole bunch. Where is the prudential nerve? Does it send movement and sensation in the genital area, the most inferior portion of the cranial fascia? Is it interconnected deep within the brain, or is it both A and C? What do you guys think? Doing anatomy questions for a medical coding certification exam. You don't have to have a course for. You can just sit for the certification exam. You don't need any prerequisites. And I like to teach from the exam point of view, because the medical coding courses will not teach you how to pass the certification exam. They will give you an overview of medical coding, but that's not helpful in passing the certification exam. And medical coding in the United States, since everything is for profit, and nothing is universal, each medical group and health plan can make up their own rules on how they pay claims, and A lot of them do. Some people are contracted where they don't do claims to certain vendors like labs and hospitals. All you're responsible for is making sure they get a monthly check. So there's another way that you have to do auditing to make sure that you're getting enough results back based off the patient load that you sent them. Because you don't send them claims, payments. So it's very interesting. Each medical group or health plan or hospital will have to teach you and train you their way of coding, which, you know, you're already going to have to learn that. You might as well get just an overview of medical coding just from me and not have to pay thousands of dollars for a course. Thank you so much, Hemi. He is in my TikTok chat right now. He just did our goal. He's wonderful. Henry is he lives in China, and he does one of those traveling TikTok shows that I love to watch at night and in the morning time while I'm getting ready, getting the boys out to school. And he does a lot of cool sites there in China. So if y'all haven't given him a follow, give him a follow. He's wonderful. I love seeing him and his family, and they share all the wonders of China around. It's good to see you. I hope you're doing good. All right, the answer for this one is A, perfect, good job. What about when a patient is having this performed on this particular muscle? Where are we located? Are we in the foot, arm, upper leg, or a hand? Knowing the body parts, stuff like that. Thanks, Shauna. Super helpful. Henry's only been on TikTok for like 4 weeks, so he's so brand new. It's too cute to watch him get started and everything. He's got 2 adorable boys. You know I've got the 3 here, so it's fun to watch. Fun to watch them and their adventures. His boys are fixing to start back to school, I think this week. Coming up. They have a Harry Potter schedule, you know, go back to school in September. My boys have been back to school since July 31st or 30th, something like that. It's crazy. They start back so early. Good job. A is your answer. Perfect. What about this one? What kind of incisional surgeries are these? Are they approaches, hernias, organs found in the digestive system, or cardiac catheterizations? No sorries. We love seeing you. We love it. Second week of school of you guys. Yeah, you guys got to watch him. He's wonderful. Yes, Jen, been showing support since I did this, so I'll never forget. Aw, he's so wonderful. Henry is great. B, everybody get B? Good job, good job. Here's a guideline question. What is an acute exacerbation of asthma or COPD? Chronic obstructive pulmonary disease. Be sure you guys know all your acronyms. Are we going to be coding according to our guideline 1C10A1? Do you know how to find that too, by the way? We're going to code an uncomplicated asthma or COPD, worsening or decomp of asthma, an infection, or a condition that is severe enough to be admitted to the hospital. What do you guys think? Sadly, you don't think you'd be able to find it? Oh, awesome. I'll show you how to find it. All right, let's see. Where's my camera? Where's my camera? Let me turn that on. And let me pop this down here. So we're going to be looking for this IC10A. So you're going to, I don't know what kind of AAPC book you can have, since you can have any of them, but let's start in my book, in the very front of the book, and we're going to come here to the Guideline Index in the very front. And it's just like it tells you what page number each guideline is on. So if we're going to go to IC, right here at the beginning is got the big A right there. You know you're not in C if you're there, right? So we're A, and then B starts right here. We're going to go down to C. C is right there. So we'll start with the C. We found IC. Then we need to go to 10 down. 10 is not going to be on this page. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9. And in my book, 10 is over here on the second page of your ICD-10 book. So we found our 10. Now we need to find underneath the 10 an A, and it's right there. It says chronic obstructive pulmonary disease, COPD, and asthma. Oh, great. We're going to go to what page? G18. So in my book, I'm in the 2024 ICD-10 made by AAPC. So that all might be different in yours. Same method should be able to be used to find it. G18. G18, and we're looking for 10A. A is right here. There's our big 10. There's A. Then the last part that we have to find that wasn't in the index is the number 1 underneath the A. And there it is right there. And it tells you your guideline right here. An acute exacerbated chronic pulmonary obstructive bronchitis and asthma. It says an acute exacerbation is a worsening or decompression of a chronic condition. An acute exacerbation is not the equivalent of a superimposed or chronic condition, though an exacerbation may be triggered by an infection. It also tells you what to code in proper order. What's code number 1, 2, or 3, those kind of things. But that's how you find it in your ICD-10 book. Hopefully that's helpful. Move this back over here. There we go. So we saw a bunch of words where it said it was not this, was not that. Yes, our answer is B. What about a complete the series for a passage of airflow to the lungs? Nose, trachea, bronchial, and then what? I do have a study guide for the ICD-10 in my shop at medicalcodingbyjen.com. I have the guidelines where you can just copy my notes in the guidelines, and then I also have the top 10 guidelines that you need to know document with practice exam questions that go along with them that you will see on a coding exam. So I've got both those documents. Fixing to start. I just got me a new book in. I had to order another 2024 book because I'm fixing to turn this one into a 2025 book. So I wanted to get a blank one for that, and I just got it in the mail. So either tonight or Saturday night or Sunday, I'll be going live, and we'll start working on changing these books into a 2025 book, because I'm already seeing some releases of what some of the codes are going to be. So I wanted to get a head start on that. I'm trying to plan out Miss Go-Kart. Let me show you what I did to answer your email question while we're on live. What did I do with it? What did I do with it? What did I do with it? Is that it right here? Week 1? Oh, look. I want to develop a course for you guys that you guys can just watch videos, right? And we were talking during one of my last lives about somebody just make me a schedule and I'll do it. And then I found one and created one. So let me show you what I did at least get that part done. So let me hit this view to view one page at a time. But yep. So what I'm doing is, like, if I did a 12-week course for medical coding, all in videos, what would we do on day 1, right? What would we do on day 2? What would we do on day 3? That kind of thing. And I started creating the videos. So on my YouTube channel, I've got a new playlist that is called Medical Coding something. What did I name it? It's been a crazy day. Medical coding something. What did I name it? Let's see. Medical coding course. Okay. It's called Medical Coding Course. And I got a couple of videos in there where I'm doing just the business of medicine, right? I'm starting with chapter 1. What is medical coding? What is the differences between the providers? Those kind of things. So I did make out the whole 12-week list of videos, and then I'm going to put them all in that YouTube thing. Where am I at? Where's the YouTube? Let me go here and show you guys on YouTube. Will that work? Yeah, maybe if I turn it on. There we go. And which YouTube thing am I on? Am I on this one right here? Yep. And so that very first right there, if you go to home, this is what you'll see. But scoochie over the top where it says playlist right there. And that first playlist right there is called Medical Coding Course. And that's where I'm going to stick all these. Right now I'm just doing the business of medicine, part 1, right? And then I'll have some examples and stuff like that. But I'm trying to build you guys like a 12-week course, whatever, all of videos, whatever on this. Now, right now, do I have this as all? It may not stay open for everybody. Oh, I hate those ad blockers. Like I may have it switch over to be members only. But for right now, it's universal. Anybody can see it. But as I get closer to filling up and finishing the whole 12-week course, I'm pretty sure it's going to end up being just for the YouTube memberships, but still pretty cool. I should have done that before now anyway, so hopefully that will help. I'm working on it. But to answer your question that you had in your email about it, I've got it planned out. I've got it done of all the subjects that we need to cover, and I'm rolling with it. Go-kart. Oh, let me fix my TikTok. It's want me to do the puzzle. Oh, my fat fingers are always in the way. Refresh, refresh. Come on. Come on, live. It's not giving me a puzzle piece, but anyway, I've got the whole 12 weeks planned out. There we go. There we go. I did the verification. So I am starting that video list. Let me switch this back to our other document. Back to which one? That one. And go back to that one. Put this back up there and let me get TikTok working right for some reason. Why is this not going? Word. See what I did. What I do? Turn that off. Turn that off. Get back to our practice exam questions. There we go. There we go. This question about our passages of our lungs. Answer is B, of course. Thanks, Go-Kart. I think we already did this question, right? We did this one, was hernias. We did this one already. Perfect. This is a new one that y'all may not have seen before. What about which of the following is not true about a human fetus? From 3 months until birth, the development tissue is called a fetus. The fetus, it gets nutrition from the umbilical cord. Amniotic fluid surrounds the fetus, and the fetus is held in the host below the cervix outside the uterus. I've actually seen that happen before, D, but it's unusual. I've had somebody go full term with an abdominal pregnancy, actually. So technically, I don't know if I like this question. It was something new I hadn't seen before, so I just grabbed it and threw it here, but I haven't done it before. Do you have the guidelines for review? Yes, I do. I'm sorry, Mabel, about the ads. I can't get enough of your teaching, lady. Did my test already, but here I am still. You're amazing. Aw, thanks, Nita. You're awesome. I'm glad it helps. If you ever need anything explained, you want to know why the answers are what they are, just leave me a comment on any of the videos. That helps out. Lets me know what I need to explain for you guys. When a physician refers to an area that is superior to the neck region, what are they referring to? I do have a case coming up, so I know y'all like to practice cases. The most appealing area on the body, the area above the neck region, the area below the neck region, or an area with the greatest distance from the neck. With the books, read your guidelines, and YouTube help. You can start with the videos she was just showing. That's perfect, Shauna. That's excellent advice. Good job, Coach. It is B, above. Superior means up, above. Yep. All right, this is our case. This one's going to have like 5 questions all in one. The first 2 questions are E&M related. Is this going to be a new visit? Is it going to be an initial admit hospital visit? Is it going to be an outpatient consultation? Or are we inpatient consultation? Are we straightforward? Are we low? Are we moderate? Or are we high? That's the only things that I'm going to be looking for in my question. I'm going to be looking for, where is the patient? Are they in the office? Are they in the hospital? This is an office too. That'll get me down to just a 50-50 shot, right? Because these 2 are in the hospital and the other 2 are in the office. The next answers that they're going to want is 3 diagnosis ones. And the first thing that I'm thinking about when I look at this one is B and C means the patient has an injury, right? If it's A or D, then they had no injury and they just have a muscle, skeletal, something or another issue, right? So, do they have an injury or do they have a muscle issue? And one interesting thing that you could think about, we do have some external causes down here. That might give you a hint as to what the first code could be. Your second code, they want to know, are we a muscle one or are we a status code one, or do we not need any code at all? And then our last one will be an external cause. The 2 that are the most similar are the 2 18s. The only difference is, are we a 40 or a 43, since those 2 are the closest. But keeping all of that in mind, and we don't need to know how old the patient is. We don't need to know a lot of things that are going to be in this note, so don't bother reading it. We just need to know our patient status first off. Are they in an office, outpatient setting, or are they admitted? Okay, if they're admitted, are they straightforward, low, moderate, or high visit? Then we can move on to our diagnoses, okay? This is going to be 3 pages long. Where is our patient? Office visit. Or hospital. Yep, we are definitely in the hospital, so we can get rid of those 2. Does this equate to a hospital admit, or is this a patient consultation? So we do see the very first word right there is a consult request. D, okay. We'll pick D as our first answer. What about the level of visit? If we don't have MDM or time, what would be the level of our visit? What is our problem list? What's our data? And what is our risk? Or is time noted here? No time. So our problem list is hip fracture. We had imaging done. Did they review any outside records? From another physician, or did we take a history from somebody else? And then what did they decide to do? They plan to fix her hip fracture. Doesn't look like we had any outside records or anybody else that they had to interview. She seems to have told them what she was doing. She was mopping the floor. She's awake, alert, oriented. So would you do a level 2, 3, 4, or 5 on her? What do you guys think? She was already admitted before this doctor got here. Patient was admitted last night to the hospital. Today, Dr. X comes in to see her. So that's why she's not an admit today. Today is her consultation. She was admitted last night for her hip. But for her consultation today, is she a level 2, 3, 4, or 5? She had the x-rays done last night, probably, and this doctor probably reviewed them. X-ray, hip, and then surgery for our problem, data, and risk. I got some D's. For a hip fracture, y'all gonna give her a straightforward? That's a decision for surgery. If you look on your CPT book, right? And we go look at page 8, 9, where here in risk has decision for surgery. Straightforward has diagnostic testing, maybe an x-ray. There's no decision for surgery for a straightforward. Low has a diagnostic test too. No decision for surgery. Moderate has decision regarding an elective surgery without the patient, without identified patient or procedures risk, right? And then if we go to level 5, which is high, we also have a decision regarding emergency major surgery. We also have a decision regarding hospitalization, escalated, do not resuscitate, that kind of stuff. So the only two options when you do have a decision for surgery is either high or moderate. Those are your only two options. When you see somebody's made a decision for surgery, you can't do anything lower, I don't think. What was the question, Jessica? Let's see. What's the best way or easier way to understand modifiers? Got it. Modifiers. I'll answer that as soon as we get done with this. It is going to be a level 4, a moderate. Because it's not an emergency, she was admitted, she's comfortable, she's not in any pain, she doesn't have any life-threatening issues. We reserve the 05 for something. Now, if this patient needs a hip replacement, but they're also on dialysis, they have a bunch of comorbidities that make her high risk. She's like 99 years old and she's on dialysis with a hip fracture. Yeah, I'd put her at 05 or whatever. But just a moderate risk. She's not too old, 60 years old. She's healthy, been mopping. She just has high cholesterol and a pepsid ulcer. You know, no big deal. So she's going to be a level 4, I believe. All right, for her diagnoses, are we going to give her an M code or an S code? Like, did somebody hit her with a car? Or did she just fracture her hip? That's how you kind of have to look at this. Hi, newbie. Glad to see you. Hey, Elizabeth. Good to see you. Would there be an additional diagnosis, and what would be her external cause? We still got 41 people on and 24 likes on the YouTube channel. Put in chat what you think all 3 of the diagnosis code answers would be. Get rid of that camera. Travis, turn that off now. You're not allowed to be on that, and you know it. That is not on Prime or not on our Good night, McNair. Love it. Come back and watch again some more. Look at Fagan. They're saying A, D, and B. Close. We have our inpatient consultation. D is our answer, of course. We've got our 99254 is what it would be for our consultation. Patient has 2 elements that meet level 4. The number and complexity of problems addressed was moderate, acute, complicated injury. The amount of data was low because we just had the 1 x-ray. The risk is moderate because of the elective surgery. So that makes the patient a 99254. Our diagnosis code was M80052A. She wasn't hit by a car or anything. We don't need a secondary diagnosis code. And her external cause was actually C. She slipped on a wet floor. So if you looked at slipping, it would be just the W01, which they've got 2 answers that have the 18 in it. So they kind of tricked you on that one. And then the 2 closest was the 40 and the 43. I pushed you towards that. Ended up not being in that area. Let's go look that one up. W18. If I was just guessing, you know, I don't know. It's hard to guess because you can't just pick the 40 or the 43 because you're in ICD-10 and it doesn't matter what, like it's not a higher price because the code goes up like it is with CPT. It's a little easier just to pick the smaller of the 2 codes. With this one, you got to go make sure you're under the header of 1018. W18 is a fall, and falling isn't what she did. She slipped. So if you'd have went there, you might have known that she didn't fall. She slipped. That's a rough one. But if you go over to your W01, you'll see that she slipped on the same level of the floor as what she was working on, right? Yeah. Oh, let's see. She slipped on the wet floor. And that's not the same thing as falling for some reason. Don't ask me. She still fell down on that hip hard enough to break it. Same thing my mom did. She tripped. So my mom tripped over a cord that got tangled up in her feet. So she wouldn't have been a fall and she wouldn't have been a slip. There would be an external cause for tripping. So they're really specific back here with these things. But I would have thought it was one of the 18s too. Just because those 2 are super close together. All right. Modifiers. To answer your question about modifiers, the only reason we use modifiers, where's my camera, is because we need to change something, right? So we've got this little lovely list of modifiers in our CPT book. And if we're going to add them to something, it means we have to add them because we need to change a descriptor in the CPT book. So if like we did anything today, like, I don't know, 63478, it's an endovenous ablation therapy for a vein that's acting crazy. We're going to ablate it of the extremity. It includes all imaging guidance and monitoring. It's percutaneous. We are using a laser, and we are first vein, and it's the first one being treated. We're doing this procedure today. The only time we would add a modifier to that is if we have to change what's being said right here to notify the insurance companies or whoever that there's something else going on. What could it be? We could use probably the 22 modifier for an increased procedure. Yes, we only did it on one vein. Yes, it was the initial time that we did it, but due to the patient's size, maybe they were like extremely morbid obese, you know, like a 500 or more pound person, and you're trying to get through all that subcutaneous and fat tissue to get down to that one vein to ablate it, and it just took them way longer than a normal, even normal painful procedure to do. If it took like double the time of the physician, you could add the 22 modifier for increasing that procedure. If it was mandated by the insurance company that they were required to do that service for some reason, then that's where your 32 modifier comes in. I don't think you could do this for a bilateral procedure because it says for the first vein in the CPT code descriptor, so I don't think we could use 50, but we could use the 51 modifier, like a 51. What if we did this procedure, first vein treated? Nope, we would not use the 51 because it's got an add-on code for the 79. So because it has the subsequent veins afterwards, add-on procedure, then that means we could not use the multiple procedure or a distinct procedure modifier for that one. It should not take a surgical team to do. I don't know if you could do this as a repeat procedure. What if we did it a week ago and it didn't work and we had to bring the patient back in to do a repeat? Maybe. There's a modifier for same physician or a different physician. This physician didn't do it right. The patient demanded to have a different patient do it. Then you do it by a different physician. So there's 276 or 77. What if they left a sponge or something in there? Then it's an unplanned return back to the OR or something. Following the initial procedure for a related procedure during the postoperative period. I don't think we can use an assistant for this one. But that kind of stuff is all we're doing here. It shouldn't be considered a preventative service, so 33 probably wouldn't work. But the only time you use a modifier in the CPT book is if you're going to change the descriptor that you're attaching it to. All add-on codes, the ones with the plus symbol beside them, in general, I've never seen it, but they do not get modifiers ever. So a modifier probably could be added to its parent code, the one code that goes before it, but those codes don't get modifiers, so that's handy to know. My notes do come with helpful information before each section. Right before you code it, it'll give you the list of modifiers we're going to use in this section and which ones we don't use, so that's helpful. like in the nervous system, we would never use, what is it, 62 and something else? I forget what that is, 62 and 64 or something like that. In our nervous system, I'll put it at the top of our notes so that you guys know. I attach, if you can times a code and it's an each, then you know you can times it, because I'll add that note underneath the CPT code so that you know you can do that. That's super helpful. But modifiers are only there to change the descriptor. So think of it that way. If you're not changing anything here, you know this is what you did, then you're good. You're good to go. I hope that helps. Yep, she was at home mopping. Was that helpful? Yes, Goose Pack has modifiers with it, yes. If you bought Duck and you want to upgrade to the Goose, just go buy the Goose, send me a message to cancel your Duck, and I'll make sure that that gets sent back to you and will end up being only on the Goose. Just checking messages. Let me send out some subscriptions. I forgot about that. While you guys are here, give out some, y'all gotta remind me, I keep forgetting. There's the YouTube subscriptions. Giving out some YouTube subscriptions. Let me buy 5 YouTube subscriptions. And let's see who wins. You're very welcome. Good night, Erin. I know it's late. Yep, I'm done for tonight anyway. I hope that is super helpful for everybody. Jessica, Taylor, April, Elizabeth, and Clinton all won YouTube memberships. You guys all have access to the old workshops, the old duck classes. Those are super helpful because they're just hours of back-to-back questions without me talking a whole bunch. We're just going from practice question to practice question. So you guys can pause the screen on those, turn my voice off, and just set a timer on your desk and see if you can't get through each question in 2 minutes time. If you can, and you can get 90% of them correct, then you're pretty much ready for your exam. That's a good indication if you can get through a whole workshop and get a whole lot of them done. About 90% of 75 is whatever, like 15. Don't miss no more than 10 of them. Then you're ready for your exam. You only use modifiers when you need to change your CPT code descriptor in your CPT book. So any CPT modifiers, they're only used if you're going to change the CPT descriptor. Did I use a second surgeon? Did I do this bilaterally, but the procedure is unilaterally? That kind of thing. Is this a repeat procedure? Those kind of things. Super helpful. You're welcome. Thank you so much for all the super chats, the subscriptions to the YouTube channel and to TikTok, and all the hearts and roses and things like that. The super chats on the YouTube videos are wonderful. Thanks so much for sending those. Somebody sent one this week. I can't remember who it was off the top of my head, but that was so cool to see that. If you guys need anything, I'll be around making my course videos and pushing those out onto YouTube. I'm also working on material for next week's lives, and my tutoring sessions. So I've got people scheduled for tutoring. MK we did yesterday. I got to do another one with her. Go-karts next week. I got to figure out when we're going to start up duck classes again. So I'm still working on that. I will keep y'all informed. I hope this is super helpful. You're going to take yours in 5 weeks, Jessica? Oh, I hope I help out a whole bunch. I'm so proud of you guys. Love you guys. I hope this was helpful, and look for me to be back again live to do, we're going to change a 2024 book into a 2025. At least for the codes that I know so far that are changing. So this is just pre-planning for next year. Nothing you guys need to worry about if you're going to take your exam by December 31st. But I'm just getting a head start on it. I hope this was helpful. I will see you Monday night for another 2 hours of free lessons.